I wanted to take this time and talk about why the topic of my website is important to me. So, the topic that I chose for this project is how COVID-19, also known as coronavirus, has affected speech language pathology therapy in the Tampa Bay area. As a kid, I've always been a hands on learner ever since I was a child. When I moved to Florida, I had a very strong northern accent and I was one of 6 children. So I often spoke at a very faster rate in order to get my sentences out in order to be able to communicate. I definitely had a hard time producing my hard R sounds, and I needed speech therapy up until I was in about 3rd grade. I could not imagine as a child having to learn those same techniques and practices over the computer. I know that as a speech language pathologist, it's very important to look at the mouth and the voicing of words, and that is often quite hard to do when you're doing that over video camera. If the kid is not sitting straight, not looking at the camera, and just making it a little bit harder for the speech language pathologist in order to examine the child. As an early adult, doing homework, watching lectures, and taking notes, I struggle with focusing at my own home. There are so many other things that you could be doing rather than homework, such as laundry, watching television, cooking. There's also a lot more noise distractions. I do live in St. Petersburg, Florida. It's a very busy town. I live off of the main road. There's often a lot of distractions of sirens or even noisy neighbors while living in an apartment. That also can come across on camera and distract a child from focusing with a speech language pathologist. Can also create background noise for the SLP to communicate needs from the child. I know as a child there's tons of more distractions and your attention span is lower than an adult. I feel like being at home, you're not receiving the same quality of care, and that's not due to the SLP. It's just due to all of the distractions that it can cause a child. I know I personally focus better on assignments when I'm not in my own home. I always like to go to the coffee shop or to the library in order to work on large assignments because I know that I'm going to produce it at a higher level. COVID-19 was so highly affected by the Tampa Bay area. I've lived in this town almost my whole life, and seeing the entire city shut down was very difficult. I saw how it affected small businesses. Like I said, I do live in the St. Petersburg area, and I know that it highly affected downtown St. Petersburg. Tons of businesses had to close down permanently because they were not able to make money during the 2 months that the whole town was shut down. I know that that did have a negative effect on their business, meaning that things were shut down. Knowing how it affected businesses, I know how it affected the rest of the area. Ever since I was a kid, my mom has worked in a school for the Pinellas County School Board. She works at Northeast High School as of right now. I know that a lot of that was very difficult for her, supplying computers for students, having teachers who weren't even the most tech savvy learn a computer system and how to get kids online, and just making sure that they were getting the same level of instruction was very difficult. Once the school opened back up and kids had the option of going online still or coming back into the school, I know that was also a big adjustment. Kids readjusting to waking up early and going to school and having that more of a structure rather than being at home. When they did open back up, a lot of extracurricular activities were not happening. There was no football games. Some kids didn't have a prom. They didn't have a graduation. I know that definitely affected students. Tampa is also a very divided city. There are some areas of the city that is very nice and are very of more of a higher status in comparison to a lot of lower income schools. My mom's school is a good example of this. Some of the kids that go there have a rough home life. She does busing and transportation for schools, so she requires and looks into students who need busing and who need financial assistance. A lot of those children rely on financial assistance from the school board, and a lot of those children that might need speech therapy also rely on having that paid for and taken care of from the school board while they're in school. A lot of parents cannot afford a private practice or paying an SLP to come into their home and help their child. That's going to affect them in the long term as well. Not having an SLP for a few weeks can definitely affect the progress that a child is making with her. I know that for an SLP too, they have been working online for a while now. But when your student is fully online and they are more of a hands-on learner, that's going to place a lot more difficulty on ensuring that your child is going to be able to excel. That is the main priority, is the children and your patient and who you're working with. So making sure that they are going with everything that they need is going to be a lot more difficult when you're doing that online. Like I said, a lot of the students and parents cannot afford for their child to go to private practice, which is definitely going to affect their development later on in life as well. It's very important that when you have a young child that you catch it early on for speech development. It can affect them in the future if they're not getting the help that they need right away. This topic, like I said, is very important to me just because I have taken speech therapy as a child, and seeing how I did with it, I know that it would be very hard to do it now as a child, and knowing that even as an adult, I have a hard time focusing. I can't even imagine as a 4, 5, 6-year-old how tough it would be to sit on a computer and try to receive any sort of therapy. Even for personal therapy now, I still go in person as an adult. So I just can understand the stress it would place on a family knowing that their child would have to go online for something such as speech therapy during the time of COVID-19.